What are contraceptives? Contraceptive primary purpose is to prevent a pregnancy. For example, contraceptive can stop ovulation or the release of an egg, stop the meeting of the sperm and egg, prevent a fertilized egg from attaching to the lining of the uterus. The choice of getting a contraceptive can depend on how sexually active you are, how many sexual partners you have, if you want to have future children, and your overall health.
Are there other uses for contraceptives? Aside from the common use for pregnancy prevention, contraceptives also have numerous other health benefits, such as lowering the risk of pregnancy that may be related to morbidity and death, lowering the risk of reproductive cancers, easing menstrual symptoms that may ease painful and or irregular periods, may also ease migraine pains, help with acne, and ease symptoms that are associated with endometriosis and or polycystic ovary syndrome.
Why are contraceptives important? By reducing unintended pregnancies and abortions, and facilitating family planning or spacing of births, effective contraception provides both health and social benefits to mothers and their children. When contraceptives are made accessible for women of all backgrounds, it improves a woman's role socially and economically so they are able to participate within society to their best ability fully. By educating more men and women on different types of contraceptives, it reduces the stigma within society surrounding the topic of using contraceptives for pregnancy prevention or other health benefits. Having a better understanding will also reduce a woman's vulnerability to STIs or HIV due to the common use of protection being condoms.
It's important to know all of the types of contraceptive methods that are out there, and it's also important to know which method suits you better or works better with your body. Here we have listed a few examples. We have IUDs, contraceptive injections, the condom, oral contraception, the implant, hormonal ring, as well as contraceptive patches. These are a few of the general ones that we have listed below. Some of them can influence your cycle. They can make it heavier, they can make it lighter, or they can make it disappear altogether. Many of these contraceptive methods can also provide certain side effects like migraines, mood swings, appetite changes, as well as weight fluctuations. In the table below, we have listed some of the pros and cons. For pros, we know that they're good at preventing sexually transmitted diseases or STIs or HIVs. Prevention for pregnancy, which is important, and they also reduce morbidity and mortality rate. Some of the cons are that they can have impact on your hormones. Maybe you can be allergic to it as well, and they can come with multiple side effects. The science behind contraceptives. Two important hormones involved in ovulation are the follicle-stimulating hormone, FSH, responsible for stimulating the production of an egg, the luteinizing hormone, LH, responsible for releasing the egg. Both of these hormones are produced in the pituitary gland. The ovaries produce progesterone and estrogen, and these hormones are at high levels after ovulation. Progesterone and estrogen suppress the follicle-stimulating and luteinizing hormones. By suppressing these, the ovaries get a signal to not release an egg. This is important because it helps us understand how birth control works. The birth control pills contain estrogen and progesterone, which send a signal to the ovaries to stop the release of an egg. In order to access birth control, one can visit their doctor or the local clinic to get a prescription. Most insurance programs cover the cost of birth control since it's a form of preventative health care. Most states allow women of reproductive age to receive birth control, and parent permission depends on their doctor or clinic. Planned Parenthood is another great resource where women can access birth control methods and where they can discuss their health with providers. Access to birth control is important, as we have discussed earlier in this presentation. In the United States, there are more than 19 million women who live in contraceptive deserts. Contraceptive deserts are defined as counties where the number of health centers that offer methods of contraception does not meet the need of eligible women who can receive publicly funded contraception.
What barriers are there to getting contraceptives? Well, the cost is a barrier because it could be difficult for someone to afford it, especially if they don't have insurance. The stigma associated with contraceptives may prevent them from getting a contraceptive. Some clinics may require teens to get their parents' consent, but those are few. The location of doctors, office, or pharmacies may be too far, making it difficult to get access. And if they don't have access to accurate information, it may prevent them from making an informed decision on choosing to use a contraceptive method or not. And unfortunately, there are many more barriers. And the video on the left, titled Eliminating Barriers to Contraceptives, would be able to help you to learn more about barriers a teen may face trying to access a contraceptive method, as well as present solutions.